So once again, a big welcome, okay, ladies and gentlemen, to all of you, right, for attending tonight's webinar. So I'll start off with thanking EVG and my upline for introducing me nutrition immunology into my life, right? And also a big welcome to every one of you, right, for spending your time to actually join us tonight. And tonight we are covering world #1 killer, cardiovascular disease. And before I come to that, okay, I have some announcement to make. Wait for AV team to put up the slides, okay? Okay, basically the announcement is like that. Okay, you realize that no, AV team actually mute your the Zoom app, right, to prevent any interruption to the meeting. So we thank you for your cooperation. And in the throughout the presentation, right, you can actually use the chat function, as I mentioned earlier, to interact with us. Okay, and also a later part, there will be a Q&A segment whereby you can use this function to ask your question. Also, you can also, if you don't want to type it out, you can actually, open up, turn on your mic and actually voice out your question. Okay, people who use phone, okay, for using mobile to view, you can actually maximize your reading experience by zooming in to the slide, by pinching in and pinching out for better clarity. So tonight, as mentioned, okay, we are covering cardiovascular disease, the #1 killer in the world. So when we say #1 killer, means that a lot of people has died from this disease alone. Okay, from WHO, right? Mentioned about 17.9 million of deaths per year from cardiovascular disease. Okay, and also cardiovascular disease actually means diseases relating to the heart. Okay, and do you know what are the different types of cardiovascular disease? Do you know actually how they actually take place, and what are the things that we can actually do to prevent it from ever happening? What are the superfood we can actually consume to take, right? To stay away from these illnesses. So with that, okay, tonight we have invited a speaker to tell us all about it. So let's put our big hands together for Cindy Khoo.
Good evening, everyone. Firstly, I would like to thank EV Global Network and my upline. I am Cindy Khoo. Today, I will be sharing on how to prevent cardiovascular disease. In today's society, medical science is so advanced, but many people die from disease such as cancer, diabetics, and heart disease. And according to the statistic by the World Health Organization, cardiovascular disease is the leading cause of death worldwide. An estimated 80 million deaths yearly are due to cardiovascular disease. It is projected that there will be more than 23 million people dying from cardiovascular disease each year by 2030, meaning in every 3 people, there will be 1 dying from cardiovascular disease. Hence, to keep the deadly cardiovascular disease at bay, we should actively keep the cardiovascular system healthy. So what is cardiovascular disease? Cardiovascular disease includes heart disease, stroke, heart failure, arrhythmia, which is irregular heartbeat. So let's take a look at the cause of cardiovascular disease. Atherosclerosis, hypertension, high cholesterol, high amount of omega-6. It leads to inflammation in the blood vessels, leading to atherosclerosis, increasing the risk of heart disease and stroke. Let's take a look at how atherosclerosis is formed. Atherosclerosis is a disease in which plaque builds up inside the arteries. Plaque is made of cholesterol, fat, calcium, and other substances in the blood. Hence, unhealthy blood cholesterol levels are a major risk factor for atherosclerosis. When bad cholesterol, which is a low-density lipoprotein, which is LDL, accumulates in the artery wall, T cells are activated and attack the bad cholesterol, thereby causing inflammation that leads to atherosclerosis. To eradicate this problem, we should eat a balanced diet, control cholesterol intake to stop inflammation in the body. Another common cardiovascular disease will be hypertension. Blood pressure is the force of blood pushing against the wall of arteries as the heart pumps out blood. Hypertension occurs when constant excessive blood pressure on artery walls. When one's blood pressure reading is higher than 140/90 is known as high blood pressure. The bottom number is diastolic pressure 90. Top number is the systolic pressure 140. What is the healthy blood pressure range? The normal blood pressure range is 120/80, where the diastolic pressure is less than 80 and the systolic pressure is less than 120. Hypertension causes T cells to accumulate in the kidney, causing kidney dysfunction, leading to the weakening or loss of kidney ability to excrete water and sodium. Hence, hypertension is often known as the silent killer. When one has hypertension, the doctor will also prescribe some antihypertensive medications. Have you thought of how antihypertensive medications help to lower the blood pressure? It reduces blood volume. Some antihypertensive drugs help decrease the amount of blood the heart pumps each minute. An example will be a water pipe. We have to turn down the faucet to have the water flow smaller and relating back to our blood vessels. It means that the drug only helps to lower blood pressure, but the rubbish or the waste still remain in our blood vessels. Hence, the drug does not solve the root cause. Another type of antihypertensive medication helps to promote urination, which are diuretics. Diuretics inhibit renal tubular reabsorption of water and sodium to increase excretion of water and sodium. This leads to the dilation of blood vessels and lowering blood pressure. The third type of antihypertensive medication dilate arteries by relaxing vascular smooth muscles in arteries and veins. This temporarily controls hypertension and reduces its symptoms. Have you heard that taking antihypertensive drugs can help to solve hypertension? I'm sure that is a no. Doctors will advise patients to consume this medication for a lifetime. Why is it so? If we stop taking, the blood pressure will spike up, as this drug can only alleviate symptoms but cannot treat the root cause. Let us take a look at the side effect of this drug. When taking this drug, we have to be extra careful to follow the doctor's instruction on how to take these medications. These are some of the common medications. Lisinopril prevent blood vessels contraction, but it can cause persistent coughing, kidney problem, dizziness, rashes. Digoxin increases force of heart contractions, slow irregular heartbeat. Side effect will be irregular heartbeat, loss of appetite, nausea, impaired kidney function. Warfarin sodium, which is the blood thinner. The side effect is nosebleed, gum bleeding, easy bruising. Spironolactone diuretic is diuretic. Side effect, poor kidney function, low blood pressure. This medication can only control the symptom. It cannot help to improve the flexibility of blood vessels wall. Hence, drugs alleviate symptoms but cannot treat the root cause. If we want to improve our cardiovascular health, we have to understand the cause of cardiovascular disease. In fact, many diseases are due to what we eat. What do many of us like to eat? Many of us prefer to eat meat, seafood in our daily diet. According to the American Heart Association, the recommended daily cholesterol intake should not exceed 300 mg a day. Let's take a look at some of the cholesterol in food so we can choose our food wisely. Meat, animals in nuts, pig's brain, 2,530 mg of cholesterol. Cow's brain, 2,054 mg of cholesterol. Kidneys, pig kidney, 480 mg. Cow kidney, 387 mg. Pig liver, 368 mg. Sausage, 150 mg. Seafood, codfish, 40 mg. Prawn, 170 mg. Lobster, 85 mg. Salmon, 86 mg. Crab, 100 mg. Cuttlefish or fresh squid, 248 mg. Some say that they don't eat meat or seafood, but they like to consume eggs and dairy products. Let's take a look at the cholesterol in dairy products. An egg yolk, 266 mg. A duck egg yolk, 619 mg. A quail egg yolk, 74 mg. I'm sure we will usually eat a few like 4 or 5 at once. This will definitely exceed the recommended amount. 101 gram of scrambled egg has 435 mg. 100 gram of cream, which contains 140 milligram of cholesterol. There are 100 mg of cholesterol in cheese. Ice cream also has cholesterol. Every 100 gram of ice cream contains 45 mg. 100 gram of milk has 13 mg. Cholesterol in oil. Next, we look at cholesterol in oil. 100 gram of chicken lard contains 74 mg of cholesterol. Have you tried pork lard, rice, or use lard to stir fry or barbecue? Isn't it very fragrant? But lard has 56 mg of cholesterol. 100 gram of butter has 260 mg of cholesterol. Vegetable oil, 0 mg. Although vegetable oil does not have cholesterol, it is a major cause of cardiovascular disease. Let's take a look at fast food. Do you like to eat Western food like hamburger and fries? A small burger has 30 milligrams of cholesterol. A large double cheeseburger has 80 milligrams. Fish fillet burger, 40 mg. A small cup of strawberry milkshake, only 178 grams, has 25 mg of cholesterol. From here, we see that our diet can easily exceed the cholesterol intake daily. Hence, we should choose more healthy and low cholesterol food, which can reduce the risk of cardiovascular disease. Why do vegans, even avoiding dairy product and egg, have high cholesterol? Shouldn't they have no cholesterol at all? Sure. So where does the cholesterol come from? Actually, 25% of cholesterol comes from the food we eat, and 75% of cholesterol is actually produced by the liver. That is why, despite being a vegan, the cholesterol level can still be high. And why does our liver produce cholesterol? Let's learn more about our liver. Our liver produces 75% of the cholesterol in the body. And let's take a look at why our liver is one of the most important organs. Our liver is the largest gland in the body, and it has over 500 different functions. The main functions of liver are detox, filter, and cleanse blood. If our liver malfunctions, it can lead to dull skin. Spots starts to show up on our skin. Make bile. Some people may suffer from digestion problem. This may be related to the malfunctioning of liver as well. Burn fats. It is our major fat burning organ. If you wish to have better slimming, weight loss result, we need to make sure our liver is healthy. Regulate blood sugar level. If our quality of sleep is not ideal, it can affect our liver, which in turn result in an unstable blood sugar level. Release of energy. Have you noticed some people are always tired despite getting enough sleep? This is because our liver stores carbohydrates for energy. Hence, when our liver is damaged, it is not able to store carbohydrates. Hence, we must take extra care for those with such symptoms. Synthesize hormones. When our liver is malfunctioning, it cannot produce the needed hormones for the body to function normally. For example, androgen and estrogen, which will lead to endocrine disorder. Especially in modern society, many people are prone to being more tense and stressed. And many hormonal imbalances are linked to our liver health. Make cholesterol. From where we can see that many health problems are related to the liver. But why does liver need to make cholesterol? I used to think that cholesterol is a bad thing because cholesterol is one of the causes of cardiovascular disease, and high cholesterol require long-term medication. But in actual fact, we need cholesterol. Without it, we can't live. Earlier on, I mentioned that 75% of cholesterol is produced by the liver. Cholesterol is one of the most essential substances the human body needs it to form cell membranes. Let's take a look at the picture on the right. The smallest unit of a cell is our DNA. Every cell in the body can contain cell membranes. So cholesterol plays a very important role in forming cell membrane. In addition, cholesterol is also vital for the synthesis of hormones in the body. For example, the body secretes androgens and estrogen. It needs to have sufficient cholesterol. If the liver is not healthy, it may cause the endocrine system to become unbalanced. Have you heard that sunlight has vitamin D? In fact, there is no vitamin D from sunlight. Our body synthesizes the sunlight we are exposed to and the cholesterol in our body into vitamin. Therefore, cholesterol is an important element in the synthesis of vitamin D. However, we must take note that when our liver produces too much cholesterol, the body's total cholesterol will be too high, which will increase the risk of heart disease and stroke. Every time we go for a medical examination, a blood test result contains a cholesterol report. One is LDL, commonly known as bad cholesterol, and the other is HDL, commonly known as a good cholesterol. In fact, Dr. Zhao Feizhen said, our body does not have the so-called two types of cholesterol, good cholesterol and bad cholesterol. When the liver produces cholesterol, it will transport the cholesterol to the cell in need of the body. It is called low-density lipoprotein cholesterol, LDL. It's like a cellular calling out who needs cholesterol. That is when the cell membrane and hormone will take in the cholesterol. When there is excess LDL, it will directly deposit into our blood vessels, forming plaque. If it accumulates over time, it will cause atherosclerosis, causing severe blood vessel blockage, leading to stroke and heart attack. So the higher the LDL, the worse it is for the body, which is why we call it bad cholesterol. If our liver is healthy, it will produce enough high-density lipoprotein, which is good cholesterol, which is a HDL. Its function is to collect the LDL in the blood back to the liver where it is broken down. It removes cholesterol from the artery wall, prevent atherosclerosis, and reduce the risk of heart disease. So the higher the HDL, the better for our body, which is why we call it the good cholesterol. We mentioned our diet earlier, which will not only affect our cholesterol, but also our liver. If the liver is unhealthy, it will produce too much cholesterol. The health of the liver directly affects the functioning of the heart. When the liver is unhealthy, it will produce too much cholesterol, resulting in atherosclerosis. This in turn affects the heart function. Moreover, liver does not have any nerve ending, so we must take care of the liver. Earlier on, I have mentioned that vegetable oil does not contain any cholesterol. In fact, vegetable oil has adverse impact on health. Why do I talk about oil? In fact, fat is a basic nutrient required by the body, where it is divided into omega-6 and omega-3. The Vegetarian Society of the United Kingdom Limited recommend an omega-6 versus omega-3 ratio of 3:1 in one's diet. High amount of omega-3 help reduce the risk of cardiovascular disease, whereas high amount of omega-6 cause inflammation in the body and increase the risk of cardiovascular disease and stroke. However, modern diet contain too much omega-6 and too few omega-3. The typical American diet tends to contain 14 to 25 times more omega-6 than omega-3. Do we usually cook out your meal or eat out takeaway? If it is the latter, then it is difficult to control the choice of oil being used. Nowadays, people like to eat fried food. Hence, the ideal ratio of omega-6 to omega-3 as fatty acid in the daily diet should be 1:1 and 4:1. Let's take a look at what types of oil people use at home. Does anyone use grapeseed oil? Many people have heard that grapeseed contains OPC, which is very rich in antioxidants. But when it becomes grapeseed oil, it is no longer good for the body. The ratio between omega-6 versus omega-3 is grapeseed oil 676/1. This is so high. Cottonseed oil 259:1, which is also very high. Sesame oil is an essential oil during confinement. After confinement, the whole body can be aching as the omega-6 content is very high, causing inflammation. Sesame oil 137:1, corn oil 46:1, palm oil 46:1. It is common for people to use sunflower oil for cooking. Sunflower oil 36:1. In this table, there is peanut oil 32:0, tea seed oil 32:1. Many people use olive oil. Let's look at the ratio 13:1. It is also quite high. Soybean oil 7:1, canola oil, rapeseed oil 2:1, macadamia oil 1:1, perilla seed oil 1:4, kiwi seed oil 1:4. So now we know that the oil we eat every day increases the risk of cardiovascular disease. It's no wonder that cardiovascular disease is the #1 killer. In addition to the cause of cardiovascular disease I mentioned earlier, for example, atherosclerosis, hypertension, high cholesterol, excessive omega-6 fatty acid. What other factors can cause cardiovascular disease? The factors include malfunctioning immune system, aging, where the blood vessels lose their elasticity and flexibility, and unhealthy lifestyle, which is alcohol drinking, smoking, emotions, stay up late, unhealthy dietary habits, lack of vegetables and fruits. Such unhealthy dietary habit in the long run is one of the main causes of obesity and leading to cardiovascular disease. Besides adjusting our lifestyle, what nutrients can we take to prevent cardiovascular disease? The world #1 killer. Let me share some superfood that can boost the immune system. Blueberry. Its high antioxidant activities can reduce buildup of LDL, prevent formation of blood clot, lessen burden on liver, lower blood pressure, prevent cardiovascular disease and stroke. Hawthorn. It keeps cholesterol in check, protect against atherosclerosis, maintain smooth blood flow by dilating blood vessels, regulate blood pressure, improve heart function, and prevent the lack of oxygen in the heart tissue. Oriental raisin tree. It nourishes liver cell to regeneration, strengthen liver function, lower blood pressure and blood lipids, maintain cardiovascular health. American ginseng. It prevents LDL oxidation, prevent atherosclerosis, promote liver regeneration, inhibit growth of cancer cells, balance the immune system. Cactus is the king of plant, has excellent nutritional value. It contains more than 10,000 phytochemicals, anti-inflammations. It aids in wound healing. It also prevents atherosclerosis and accelerates tissue regeneration. It lowers cholesterol and triglyceride, reduce LDL in the body, and promote cardiovascular health. Rose. It fights free radicals and delay aging. It enhances collagen production, improves the elasticity, and prevents the rupture of blood vessels, prevent blood circulation. Cordyceps mycelium. It prevents atherosclerosis, stroke, and heart disease. It strengthens heart, lung, and kidney function. It raises HDL and reduces LDL. Clinical research. 273 took thrice daily. After 8 weeks, patients enjoy an average 17% decrease in cholesterol level. Clinical trial by Guangzhou Medical College. 38 elderly patients took daily for 3 months. 20 of the 24 patients with supraventricular arrhythmia, a form of irregular heartbeat, exhibited signs of recovery. So far, I have spoken about superfood to nourish the liver, to avoid the overproduction of cholesterol and clear the cholesterol in the blood vessels. You may think that it can reduce the risk of heart disease and stroke, is it? There is one place to check. That is our gastrointestinal tract. What should we do? Earlier on, I mentioned that there are a lot of food that contain cholesterol, and it's impossible to avoid them, as everyone still wants to eat some egg or meat. So what can we do? We can consume plant food that is rich in phytosterol, as it can speed up excretion of cholesterol from the body. The one in pink is our intestine, and the yellow one is the cholesterol we consume from food. After eating, the cholesterol will be in our intestine, where it will be absorbed into the bloodstream. What happens when we consume phytosterol? Phytosterol will compete with cholesterol to be incorporated into mixed micelles, that is in green. Phytosterol have a greater affinity for micelles than cholesterol, causing cholesterol to be excluded from the absorption process. Unable to be absorbed by the body, cholesterol in its free form is excreted. In this way, phytosterol speed up excretion of cholesterol from the body. Research shows that consuming 2.2 grams of phytosterol can reduce cholesterol absorption of 60% in a day. Let us take a look at the plant food that are rich in phytosterol. Soy. 1 gram of soybean contains 0.843 mg of phytosterol, which has the effect of lowering cholesterol. Consuming phytosterol can reduce the cholesterol content in the body by 10% and the LDL content by 15%. Research shows that consuming 1.5 gram to 1.8 gram of phytosterol a day can reduce cholesterol absorption by 30 to 40%, while an intake of 2.2 gram of phytosterol per day can reduce cholesterol absorption by 60%. From this data, you will realize that it is difficult to rely on phytosterol to prevent the absorption of cholesterol. But why do we need to mention about soy? Many people drink milk, take eggs, or make meat for protein. However, they also contain fats, cholesterol, cancer-causing hormone. On the other hand, soy is cholesterol-free and its protein is 2 times more than meat, 3 times more than egg, 12 times more than milk. Lower ADL and raise HDL. To date, there is no drug that can raise HDL, so it is recommended to consume soy for protein and it can prevent the risk of cardiovascular disease. The other plant food that is rich in phytosterol is dietary fiber. Besides, it can help to lose weight and prevent constipation. It can also lower cholesterol. There are 2 types of fiber, that is insoluble and soluble fiber. Insoluble fiber acts as a natural cleanser like a sponge, where it helps to excrete toxins from the intestine, keeping the intestine clean. Soluble fiber protects the intestine with a protective layer, so it can prevent the absorption of cholesterol, thus reducing the risk of cardiovascular disease. Which plant is rich in fiber? It is psyllium husk. 71 grams of soluble fiber in 100 grams of psyllium husk prevent the body from absorbing cholesterol and fats in the diet, thereby helping us reduce blood cholesterol and lower the risk of heart disease. If we want to live a healthy and long life, we must prevent the world #1 killer, which is the cardiovascular disease. As long as we can prevent cardiovascular disease, we can live to at least 100 years old. How to do it? Practice the way to health and longevity. To have a healthy body, we have to start from an early age. First, we must have sufficient rest and sleep. That is 6 to 8 hours a day. Next, moderate exercise. It helps to strengthen our heart and lung function, prevent coronary heart disease, increase the flexibility of the body and joint, enhance vitality, and can also promote lymphatic circulation. Stay positive and happy. When we are unhappy and feel stressed, our body will secrete corticosteroid, which will suppress the immune system, together with balanced nutrition by eating more vegetables and less meat. I hope that through my sharing, we will work together to stay away from the world #1 killer, which is cardiovascular disease. For friends who are currently taking medications for their cardiovascular condition, do practice this 4 ways to health and longevity. In the near future, I'm sure that the medication can be reduced or even stopped, of course, with the doctor's advice. I wish everyone good health and stay.
Okay, thank you, Cindy, for her wonderful and detailed sharing. Let's give another big hands for Cindy for her sharing. Okay, just to recap what Cindy has shared, I'm sure that via her presentation, you have heard that what are the different types of cardiovascular disease, for example, like heart disease, stroke, etc. Okay, there's a few of them. Okay, and also what are the causes of cardiovascular disease? For example, high cholesterol, high amounts of omega-6, which leads to the inflammation of our blood vessels, etc., etc. And also, she has shared what are the common drugs for cardiovascular disease and their side effects, yeah, so all drugs come with side effects, right? And also the importance to also care for our liver, because 75% of cholesterol come from our liver, and in our diet only contribute to about 25%. So caring for your liver is very important, okay, to reduce the bad cholesterol. And also Cindy has shared the superfood that you can actually take to care for your heart and liver. And lastly, based on the last slides, the most recent slide, shared the 4 factors to health and longevity. Do you guys remember? Okay, basically it's sufficient rest and sleep. You need to have regular and moderate exercise. Of course, you need to be happy, smile more. And lastly, balanced diet. Okay, so these are the things that she has shared, right? To actually, right, not only prevent cardiovascular disease from happening, you can actually, with this, you can prevent the majority of diseases from ever happening. So it's very important to practice this on a daily basis. So I'm pretty sure that you might have question in your mind. Are there people, right? Who actually have cardiovascular disease issue and also taking up any products to actually regain their health from there. In fact, we do have, and tonight we have actually invited, okay, a testimony sharer. Okay, his name is Darren. Okay, basically Darren is he's actually an IT professional. He actually grappled with cholesterol issue for almost a decade, and that lead to development of other health condition. And well, eventually, right, he resolved the issue with the help of nutritional immunology. So without further ado, let's welcome Darren to hear his story.
Hi everyone, I'm Darren. So I'll be sharing a past medical issue I had. Back many years ago, before 2014, I've been having slight issue with my cholesterol level. So I have always been advised after health screening that my cholesterol level has been at borderline unhealthy levels. Total cholesterol has been always hovering just above 200 at about 216 to 230-ish. But then the normal range should be below 200. LDL is above 130 at about 130 to 150, but this normal range should be below 130. So GP normally didn't recommend medicine, but always reminded me to watch my diet. So however, in November 2018, after my annual health screening, my total cholesterol was found to have shot up beyond the borderline unhealthy to unhealthy level. Total cholesterol was then 250.9 and LDL at 175. The GP advised that either I start medication or go on very, very strict low cholesterol diet from then on, and to do a review in another 6 months. So I choose dieting as usual. In April 2019, I started having very serious gastric pain issue, and I had to go into A&E twice within 2 weeks period. I was given painkiller drips and injection on both the A&E occasion to suppress the pain and the cramps I suffered. I was then being also referred to a gastrointestinal specialist and a cardiologist after the second A&E incident because the A&E doctor were unable to diagnose the cause of the pain. So I was scheduled to see both specialists a few days later, which by then my pain had already subsided. So after seeing the cardiologist, he instructed me to take high dosage of cholesterol medication, about the highest in fact, for 3 months. The gastro specialist found that I have fatty liver, gallbladder stones after thorough ultrascan session, but was unable to find out the cause of the cramps and also the pain I experienced. So he suspected that it's something to do with my liver and advised me to have MRI done on my liver if the gastric pain or cramps still continue to happen or it happens again. So at the same time, I got to know about the science of nutritional immunology through a family friend. And from then, I understand that to maintain a healthy level of cholesterol, I will need to have a healthy liver. I started taking numerous nutritional immunology food containing cactus, American ginseng, cactus fruit, acerola cherry, rose, cranberry, cordyceps mycelium, maitake mushroom, ABM mushroom, autumn blueberries, raisin tree fruits, monk fruit, soy, and psyllium husk. And then 3 months later, July 2019, I went back to see both specialists again. So in those 3 months, by the way, I didn't have any kind of gastric pains or cramps. And then the gastro specialist gave me an open date appointment because, cannot find anything. There's no pain. The best news came from the cardiologist after a blood test. I was completely clear of high cholesterol issue. So my cholesterol level then was back to a normal level. That's total cholesterol is 173. LDL is at 95.73. The cardiologist was very surprised of the result and reduced my medication to the lowest dosage. So in 2020, I still maintain around the same level cholesterol level and on my own accord decided to stop my medication altogether. So at the same time, I started vegan diet. And in 2021, my blood test shown that I'm still maintaining the similar healthy level without medication. And since then, my yearly report with the cardiologist continued to improve. And in 2023, my cardiologist discharged me from returning to his clinic. Why? So let's have a look. So, well, you have a look at my report here. So, these normal remarks were from the cardiologist. I told him honestly that actually I haven't been taking his recommended medication for cholesterol for the past 2 years. And the result has shown that my LDL is now at the never before in the last 10-year lowest optimum level of 93.03. Total cholesterol was also maintained at a normal level of 166.75. So I was so relieved and glad that when I heard this from the cardiologist. Now, with a healthy lifestyle, sufficient sleep, moderate exercise, and maintain positive mood, and most importantly, consuming food that can nourish our immune system, I believe anyone in a similar cholesterol condition will be able to regain back their health. So with this, I end my sharing. Thank you, and back to you, MC.
All right. Thank you, Darren, for his sharing. Okay, Darren, let me check with you, right? Just now, via your sharing, you mentioned about some plant food. I heard some plant food that you actually took, to regain back your health. Can you share with us how can we get access to all this plant food?
Sure, and thank you, MC. So back in 2019, I was consuming Elite Complete Nourishment series. So 13 meals a day for rhapsody and rosy time, and 1 sachet a day for immunity and berry bits, and 2 sachets a day for resin tree and soy green. So fast forward to today in 2024, I'm still consuming 30 meals a day for rhapsody and rosy time, and 1 sachet a day for immunity and resin tree. So I've also added a sachet of goji coffee daily during breakfast every day. So I'm very grateful to my friend and Dr. Chen for her research and development of nutritional immunology products, enabling me to enjoy my current lifestyle with my family. Thank you, and over back to you, MC.
All right, thank you, Darren, for telling us how can we get access to all this plant food, which is via Elite products. And also from the Elite product, he took the Complete Nourishment series. Yeah, so once again, congratulations to Darren for regaining back his health via Elite products, for taking the Complete Nourishment series. All right, we also feel happy for you now that you are happier and healthier than ever, right? And of course, I'd like to bring a disclaimer to your attention. All right, so basically are very beneficial for health maintenance. Okay, however, Elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical condition, please seek professional medical help. Thank you. All right, with that, we have come to the end of this segment and the start of the next segment, which is my favorite segment. Okay, this next segment is Q&A. Means that now you do the questioning and we help you to answer your question. I'm pretty sure that throughout just now, Cindy sharing and Darren sharing, you probably have a lot of thoughts in the mind that you want to find out a bit more. What are the things they eat, or how do they overcome all these things? I'm sure you probably have some questions. Okay, now if you do have some question, right, you can take this time to type out your question, or you can turn on your mic to raise out your question. All right, yeah. And because due to time constraint, every person can only ask one question. Right. Let me just look at the yeah, see, a lot of people is feeling happy for Darren, for regaining back his health. All right, okay. I think, wait, hang on, let me look at it. Okay. I think I saw a question right. Okay, it read like that. Okay, recently there have been frequent reports of sudden cardiac death. Why is this happening? I repeat, recently there have been frequent reports of sudden cardiac death. Why is this happening? This is a very good question, yeah, because really there's a lot of people dying from cardiac arrest. So yeah, and okay, for this question, right, is there anybody from the our Q&A team, right, that can actually help to address this question, this wonderful question?
Hi, Charlie. I can help answer this question.
All right, thank you, Sing Chi.
Okay, hi everybody. I'm Sing Chi. Okay, so recently, yeah, we may see frequent news reports about sudden cardiac death. Okay, so sudden cardiac death is sudden, unexpected death within an hour due to heart issue. So, as we all know, heart disease is the #1 killer worldwide. So, what are the main causes of heart disease? Let me share some slides with you. Okay, so what are the main causes of heart disease? Let me share. So first is high blood pressure, and then second is high cholesterol. And blood vessels become hardened, meaning loss of elasticity in the blood vessels. Fourth is excessive omega-6 intake, which can cause inflammation of blood vessels. In fact, many cases of sudden cardiac death have no warning signs, painless and symptomless. Therefore, today we must understand the most common cardiovascular disease, which is hypertension or high blood pressure. So what is hypertension? So when the blood pressure, which is the force exerted by our blood on the blood vessels walls, remains consistently high, it leads to high blood pressure. Generally, when a person's blood pressure reading exceed 140 and 90, that means systolic pressure above 140 and diastolic pressure above 90, the person is considered as having hypertension. So how does hypertension develop? Here you can see a few blood vessels photo. So the first blood vessel shows normal blood vessels. Second blood vessels have plaque formation on the wall due to buildup of cholesterol, fat, calcium, and other substances. Increased plaque lead to these narrow blood vessels. Then blood vessels become hardened and lack of elasticity, and eventually causing elevated blood pressure. Why are people afraid of hypertension? It is because elevated blood pressure can cause ruptures in blockage areas, leading to heart attacks or stroke. Therefore, many people take antihypertensive drugs to control their blood pressure. But do you know how these drugs lower blood pressure? So the mechanism and side effects of antihypertensive drugs. So antihypertensive drugs reduce blood volume, like squeezing a plastic water pipe. When the pipe is narrowed, it will reduce the flow, hence decreases the pressure, which is how the drugs work. Another mechanism of the drug is to slow down the heartbeat, leading to reduced pressure. Antihypertensive drugs can promote diuresis, like diuretics, eliminate body water and sodium. This lower the amount of fluid flowing through the blood vessels. As a result, blood pressure goes down. So what are the side effects then of these antihypertensive drugs? When lowering blood pressure too much can lead to brain oxygen deficiency. That means tripling the risk of dementia. Insufficient blood flow can also cause inadequate oxygen supply to the heart muscles, which will lead to heart attacks and doubling the risk of stroke. Therefore, Dr. Chow Fei Chen once said, many patients who control their blood pressure with antihypertensive drugs still die of heart disease in the end, although their blood pressure readings were normal at the time. So have we ever considered this issue? For example, asking a doctor how long antihypertensive drug should be taken. What will the doctor say? Normally, the doctor will reply, long-term use until death is necessary, right? So if the hypertensive drugs can solve the problem, why does blood pressure rise again when the drug is not taken? In fact, addressing the problem of diseases requires us to tackling it at its root cause, at its roots. So many people want to maintain normal blood pressure without antihypertensive drugs. Okay, so we have to understand the truth about the causes of hypertension. So high cholesterol and lack of elasticity in blood vessels. So high cholesterol is due to unhealthy liver and diet with excessive consumption of meat and seafood. And as we age, collagen losses and causing lack of elasticity in blood vessels. Therefore, if we want to avoid antihypertensive drugs, we must adopt healthy lifestyles and healthy habits. So no smoking, no excessive alcohol drinking, and no staying up late. Maintain a healthy liver because 70% of cholesterol is produced by liver. reduce intake of meat and seafood, increase dietary fiber before meals to avoid absorbing cholesterol, fat, calories, and toxins. So reduce oil intake to avoid taking in excessive omega-6, which causes inflammation of blood vessels. Reduce salt intake. Removing salt from diet for 2 weeks can lower blood pressure. Lose weight. Because obesity also raises blood pressure. A 10% weight loss reduces blood pressure by 10%. And also exercise more because physically inactive people are more likely to develop cardiovascular diseases. We should practice the knowledge of nutritional immunology and adopt the 4 principles of health, which are sufficient sleep, moderate exercise, maintain a healthy mood, and consume more wholesome plant-based ingredients that are beneficial to our immune system. These ingredients should be high in polysaccharides, phytochemicals, antioxidants. It should also have sufficient fiber. So we should protect our heart with these natural treasures. Hawthorn prevents arteriosclerosis, promotes blood flow, and help dilate blood vessels. Blueberries, it can prevent blood clotting, reduce liver burden, and lower the blood pressure. Cranberries prevent arteriosclerosis and cardiovascular diseases. Next, the treasures that increase elasticity of blood vessels are rose and axolotl cherries. So rose can promote collagen production for maintaining blood vessels elasticity and improving blood circulation. Axolotl cherries can protect blood and inhibit production of bad cholesterol. Then treasures that strengthen liver functions are raisin tree fruit, American ginseng, and monk fruit. So raisin tree fruit can strengthen the liver function, lower blood pressure and blood lipids, and also maintains cardiovascular health. American ginseng can promote liver regeneration and inhibits liver cancer cells growth. Monk fruit can prevent liver inflammation. So with a healthy lifestyle and healthy diet, such as more vegetables and fruits and less meat, we can help to prevent or even improve cardiovascular diseases. So I hope that my sharing has helped has answered the questions. So I'll end my sharing here. Over back to MC. Thank you.
Thank you, Singchi. I'm pretty sure, based on what I heard from Singchi, right, she has totally answered why nowadays, right, you see so many cardiac death. And of course, with so many death, you must take the precaution to actually how to prevent. And I'm sure Singchi just now share a lot of information, right? What I heard was, things that you need to do, like no smoking. If for your diet, you please reduce your meat and seafood intake. Eat more plant food, right? And also from your food, you make sure that it's less oil, less salt. And lastly, I think the one that's most important of all, just like what I share. If you practice these 4 factors to a good health, you not only can avoid dying from heart disease, you can avoid all majority of the diseases ever taking place, right? So yeah, this is so to beat diseases and a longevity, to have a good health and longevity, there's no shortcut. These are the things that you need to do on a daily basis, right? Yeah. And also and you might wonder, right? You might wonder, so today we have heard about a lot of health, a lot of things. So, and some people might be wondering, so besides, like if you take up elite business, if you take up besides, having good health via the science of nutrition immunology, right? Teaching you how to, take care of health, what are the products, what are the superfood you can eat to have a good health. Besides that, besides having good health, what are the other benefits that elite can provide? Okay, one of the many benefits that elite provide on a yearly basis is free travel. I think the best travel is free. Am I right to say that? Yeah, especially if you travel, a lot of people save up a lot of money every year just to travel, and after coming back, burn a hole in the pocket. So free travel is always the best travel. And elite travel is not only just free, but it's an expedition trip to places beyond your imagination. So this year, October, right? elite is bringing us to China Dunhuang. So having said that, let's take a look at the video to find out more.